In today's health news, the U.S. Food and Drug Administration has cleared the way for women to conduct self-testing cervical cancer. It's the fourth most common cancer in women worldwide, with 660,000 new cases identified around the globe in 2022, and that's according to the World Health Organization. So, today's announcement about that self-testing, a major development that could increase early detection for those at risk of this type of cancer. Our chief health editor, Dr. Partha Nandi, here to explain how the testing works and why it's a game changer for some women. Hi, Dr. Nandi.
I'm excited because the goal here, Glenda, of the self-test is to reach more women, which is really the goal. We've been trying for a long time, especially those who dread going to their gynecologist for a pelvic exam, which is everybody. It expands the screening options, and some health experts even say it could eventually help eliminate cervical cancer in the U.S. To me, that's super exciting. So here's how the self-test works, right? Patients swab themselves in the privacy of the doctor's office, clinic, or pharmacy to test for HPV. Now, that's a sexually transmitted virus that we know that causes more than 95% of cervical cancers. Then the sample will send off to the lab for analysis. The clinician will then follow up with the results and what next steps are needed. Now, the upside for women is this, that they don't have to undergo the invasive and often uncomfortable pelvic exam that can be very stressful and painful for some. So yay, right? Now women should still make their yearly OB/GYN appointments. We need to say that. But the self-screening eliminates the need for the doctor to perform a pelvic exam during that visit if, it's a big if it's not medically necessary. The new self-test should be available this summer. So I'm super excited about it because you reach more people.
Yeah, yay, to say the least, Doc. Can this test be
I can't tell you I know personally, but I know women that tell me all the time.
Mm-hmm. All right, well, can this test be administered at home, and how prevalent is cervical cancer today?
Important questions. Right? First, the World Health Organization say that cervical cancer is the fourth most common form of cancer among women globally. Here in the U.S., an estimated 13,000 cases are diagnosed each year, and the Centers for Disease Control and Prevention, well, they say in most of these cases, the women had not been screened over the previous 5 years. That's a tragedy to me. It's important to remember that cervical cancer can be prevented and cured if caught early enough. That's the key. The hope is that this new self-test, well, it'll increase the screening options and catch the disease before it occurs or in early stages. Unlike other cancers, Glenda, where the goal is early detection and treatment, the goal with cervical cancer is this: to find those precancerous cells, treat them, and prevent the patient from having cancer, which is great. And for now, the makers of the self-test say the first versions will be likely in use in a clinical setting only, but however, they eventually plan to offer an at-home option, which would be even more exciting because then there's more access and limiting the barrier. To me, it's great because now people can take away the barriers that prevent them from preventing this cancer, and this cancer can kill you. So,
yeah. Personal victory, actually. Thank you, Doc. And this week on the Dr. Nandi Show, Dr. Nandi looking at how today's sports could be hurting our children, from concussions to depression. Dr. Nandi tackling it all Saturday, 5 p.m. here on 7.